Valley City's vision is for all members of our communities to have healthy and secure environments that provide opportunities and services and maximize their potential and success. We know that to be physically healthy, a person must also be mentally healthy. Sadly, 1 in 4 adults has experienced or will experience mental illness in their lifetime. Yet individuals can overcome and learn to manage their illnesses while maximizing their potential if they receive the proper treatment. On average, a person with mental illness loses 25 years of their lifespan due to unhealthy lifestyles that can lead to obesity, diabetes, and other chronic conditions. Substance abuse issues, homelessness, and living in poverty are other common issues of people with mental disorders. Valley City's mission is to contribute to healthy and secure communities and a good quality of life in South King County through the development, promotion, and delivery of exemplary behavioral health care services and the related human services. Only through a triage of services, including treatment, case management, and basic human services, can an individual with mental illness and their family overcome the obstacles that have kept them from being self-sufficient, healthy, and contributing members of our community. Some obstacles to independent living that we address are a lack of transportation, housing, and childcare. There are a number of guiding principles at Valley Cities. Service excellence is our highest priority. We respond to everyone with dignity and respect. We make quality behavioral health care services available regardless of an individual's ability to pay. We believe that prevention and early intervention are the most efficient behavioral health care services. We provide behavioral health care services that are accessible, effective, culturally competent, and reflect exemplary professional ethics and standards. Our services are individualized and reflect client strengths and client choice. We are committed to the principles of wellness, resiliency, and recovery. We reflect integrity and accountability in all aspects of our organization. We participate in collaborations and partnerships that contribute to successful outcomes. We integrate advanced business technology into all agency practices. Valley City's current objective is to have outpatient mental health treatment available to all who need it. In support of this objective, we also focus our efforts on assisting clients in gaining housing stability, maintaining optimal physical health, providing intervention services, and seeking employment. There is no one element that can be truly effective without the others. Our long-term objective is to treat and triage individuals and families so that they can regain health, stability, and independence as quickly as possible. To achieve this long-term objective, we have to address the issue of stigma. Mental illness is the most common illness in the United States, and for many reasons throughout our history, we've separated the head from the body, treating them as separate and unequal. Mental illness is not a choice or a weakness, but rather a medical condition that can be treated and managed. Community-based mental health treatment is the most cost-effective treatment available because it is holistic and outcome-driven, not procedure-driven. But in order for an individual to achieve health, stability, and independence, treatment must address variables that are impeding that process. Taking medication and meeting regularly with a clinician alone will not achieve the objective. People need stable housing, appropriate health care, employment skills, and an adequate support system. No insurance plan, public or private, covers the real costs of treating individuals with mental illness. When we invest in recovery rather than symptoms, we save millions, maybe even billions of dollars, as well as lives. Valley Cities is highly successful in assisting mentally ill people through recovery and to independence because we use a team approach with every patient. This team includes a doctor and medication management team, a mental health clinician who addresses behavioral health management, a case manager who educates, addresses barriers, and connects a person to resources, a peer specialist, someone who has traveled the same journey and is in successful recovery, to help them navigate that journey, a housing specialist who specifically addresses housing stability, and an employment specialist who focuses on helping the person to find and keep a job. Valley Cities is the leader in training and fully integrating peers into all treatment teams. All the professionals in the world cannot connect with the person at the level a peer can. In fact, there is nothing more powerful in regaining hope and efficacy than working with someone who truly understands the journey. We work with universities such as the University of Washington and Washington State University to develop evidence-based curriculum. We also evaluate our processes and outcomes. Valley Cities uses lean systems analysis to create efficiencies. We use this practice to evaluate and change our intake and exit practices. We were the first community-based mental health provider to initiate same-day appointments with intake clinicians. Our consumers can walk in and receive an assessment or call in and receive an appointment that day at the location from which they will be receiving ongoing services. Valley Cities partners with other agencies, funders, businesses, and municipalities to achieve successful outcomes for our consumers. We work with housing authorities and private landlords. We work with the local schools to provide educational support for children and families. We work with local human service agencies, the courts, and other healthcare organizations to deliver results using disease treatment and management, to create self-efficacy, hope, and independence, while also reducing costs and saving lives. Valley Cities is transparent and shares our learning systems and expertise with other providers and the community at large. Valley Cities is fiscally sound and conservative. We operate with a positive bottom line, maintain a strong cash position, and continually work on cost savings and efficiencies. This is somewhat unusual in the not-for-profit world, but helps us to leverage the available funding while also building trust and confidence from our donors and supporters. The greatest challenge is that we can only serve a limited number of those who need and want mental health services. Our vision is that these services could be available for all who seek them. Valley Cities is effective because we partner. We work with local cities, schools, businesses, law enforcement, courts, hospitals, and other agencies to achieve our objectives. These objectives include the resiliency-driven mental health treatments that result in recovery, wellness, hope, and independent living. And all of this while creating healthier communities at a cost savings to the public. Valley Cities is a major stakeholder in the communities that we serve. Our hope is to be responsive and easy to work with. We provide and share our expertise in addressing the root causes of our most expensive social challenges. Valley Cities tracks our success in a number of ways. First and foremost, we get people in the door and into treatment. Not long ago, we had a waiting list, and it could take weeks for a person to receive an assessment and see a clinician. Now a person can receive services the same day they come into our clinic. We knew it was unacceptable for people to have to wait that long, so we used the Lean Systems process to successfully change our intake system. We track employment and benefit reclamation. Some people are permanently disabled because of developmental or physical disabilities or chronic mental health issues. But they can absolutely lead satisfying, healthy lives with the right support and benefits. Most people can volunteer or work part-time or full-time jobs. Employment is a major metric in recovery, so our employment specialists work with both the employee and the employer to achieve these successful outcomes. We assist employers in accessing the benefits that they can receive for hiring people with disabilities and/or our returning veterans. We instituted centralized scheduling to increase the productivity of all of our clinicians, providing our consumers with faster, better services. We accomplished this by investing in and instituting a full electronic record system that replaced an outdated and ineffective system. This better coordinates treatment within our organization as well as with other healthcare providers involved in our patients' treatment. We operate on tight budgets and continually review the cost to benefit of each program and services we provide. We must continually raise funds to support needed, successful services that do not generate a profit, such as supportive housing. Stable housing is an imperative, basic need for adults and children. Without it, a person cannot effectively address mental health issues, and children cannot succeed in school. This is one intervention that may possibly break the cycle of poverty, violence, and dependence that often traps mentally ill people. We track the number of youth in our prevention programs that graduate from high school, and our results indicate that more than 90% of our participating teens graduate from high school. We track the recidivism of domestic violence perpetrators and find that 80% of our program participants don't reoffend after completing treatment. Our management team continually reviews results and makes necessary changes to improve program outcomes. We collect data, review, audit, and report outcomes on a continuing basis. We know that there are deep misunderstandings about mental illness. Some people are fearful that all people with mental illness are violent. While some mentally ill people have committed acts of violence, most of them become victims of violence rather than being the perpetrators. Almost all people with mental illness have experienced major trauma in their lives. Trauma alters the chemistry in a person's brain and may cause a myriad of behavioral health issues that lead to broken relationships, incarceration, homelessness, poverty, abuse, or other health problems, such as obesity and diabetes. Some people mistakenly believe we are a public agency and are therefore fully funded by tax dollars. In fact, we are an independent, not-for-profit organization in the business of helping people reclaim their lives. To achieve this goal, we need a diversity of funding from both public and private sources, as well as individual donors. Recovery is possible. Because of miseducation and the stigma surrounding mental illness, many people don't understand that recovery is not only possible, but with effective treatment and adequate support can result in healthy, independent living. We take great pride in our award-winning veteran services that have received numerous awards and continue to be a leader in addressing the mental health issues of our war heroes. Our staff works closely with the VA, and our program is the only community-based mental health service provider recommended by them in our county. This program is staffed with veterans and their family members who teach cultural competency training to our staff and other agency staff members. We've been in the forefront of helping our veterans address post-traumatic stress disorder, domestic violence, and homelessness. We take great pride in our peer training program and the full integration of peer specialists throughout our organization. Our staff has developed the current promising practice curriculum called Journey to Life Wellness, which is a major step forward in recovery-focused treatment for adults with mental illness. This is also an award-winning program. We were the first community-based service provider in our state to initiate same-day assessments and appointments. We are the only mental health community-based service provider in our area operating in the black. We take fiscal management seriously. We're focused on marketing, community involvement, and fund development. A major challenge Valley Cities has faced is moving from a symptom management mentality to recovery-centered care focused on health and independence. This is a dramatic change and requires consumers to be involved in their own treatment plan from day one. Because it is a holistic, strengths-based plan that simultaneously addresses a wide variety of issues, treatment involves all variables impacting the individual, such as their mental health, physical health, poverty, abuse, homelessness, family dynamics, and cultural factors. Effective treatment cannot be done in segments. It must be fully integrated and include a wide range of support services. Historically, mental health and physical health have been treated separately, using different models of treatment. Our medical health care system, with its fee-for-service model, liability and access issues, continues to escalate in cost and is economically out of control. Mental health treatment has evolved in a different direction with tier-based payments. We are paid based on the person and their diagnosis versus the number of tests and services provided. The financial incentive is to move that person into full recovery and independence as quickly as possible. However, we have learned that mental health treatment alone cannot effectively move a person to independence. They require a matrix of support services to achieve this goal, which are not funded through any health insurance program and therefore require outside funding sources. We need people, people, people. The biggest resource challenge Valley Cities continues to face is funding to staff the professional people necessary to provide lasting positive results for both the individuals with mental illness and our society. It takes a dedicated, educated team of professionals to walk with a person or family through illness, crisis, and hopelessness into recovery, wellness, and independence. This being said, specifically, we need additional resources to maintain supportive housing. Homelessness is a major social problem, and supplying a person or family with housing is not enough. They need treatment and support to address the root causes and barriers that perpetuate homelessness. Housing is a huge financial investment requiring ongoing maintenance. We need additional resources to maintain the physical structures as well as case management services in order to move families toward independence. We also need financial resources for ongoing professional training in best practice therapies, evidence-based therapies, and management training. With additional funding, we could expand our intervention programs for middle and high school students. Additional resources would also allow us to expand our already very successful programs and deliver them nationally to help improve mental health treatment everywhere. We have done this on a small scale with our Veterans Cultural Competency Training, our Journey to Life Wellness Program, and our peer support programs. But with effective funding, we could increase our reach significantly. We are currently working with the local misdemeanor jail facility to provide forensic peer support to inmates re-entering the community to prevent recidivism and rebuild lives. This program will result in significant taxpayer savings. Additional funding will take this program from a pilot project to a fully integrated part of the system. We need flexible funding for direct client assistance on an individual needs basis for everything from bus passes to work-appropriate clothing to child care to respite care to school sports fees that might be the tipping point for a child at that particular moment in time. Once again, it's the holistic triage approach to treating mental health issues that delivers the results our society wants and needs. Flexible dollars that can be directed to where the need is the greatest are of critical importance. We would love to initiate a community education campaign to break down the stigma that prevents individuals and families from getting the treatment they need and accessing available resources. This campaign could educate the public about the cost-effectiveness of community mental health centers, and in particular, inform them about what Valley Cities is doing to help individuals and families thrive. Beyond the areas I've already described that Valley Cities would do with additional funding, we would invest in more housing because the need is so great. We would expand our integration of services and partner with other nonprofit agencies. Just as we have developed interagency treatment teams, we envision expanding with our partners into interagency teams that would have an even broader community impact. We know that there are systemic changes that need to be developed around mental and physical health care and human services delivery. We plan to be a leader in integrating effective, efficient systems that better serve individuals and families in our communities. We envision state-of-the-art adolescent mental health centers that integrate the holistic treatment approach we are currently using with adults and families. We want to grow beyond segmented services to provide fully cohesive services involving multiple agencies and including broader areas of expertise. A comprehensive treatment plan would encompass several agencies. One agency might offer physical fitness and team activities, while another agency provided tutoring and language courses. Health experts would provide nutrition education and health screenings, while mental health professionals would educate teens about abuse, bullying, suicide, and domestic violence issues. This united approach would not only result in better outcomes, it would also save money by reducing service duplications and focusing on best practices. We can accomplish all of this and more with the political will and full investment of multiple resources. An integrated, holistic approach solves problems at the root, and that's what Valley Cities is set to do. We will share what we learn with others to build stronger individuals, families, and communities.